So in vascular neurology or stroke neurology, the motto that we always have is time equals brain. And put quite literally, the longer that people wait to come in and be evaluated by medical personnel, the more brain cells die. Before 1996, if you had told a bunch of neurologists that you were going to go into the field of stroke neurology, they would have laughed at you, because there really was nothing you could do to help treat stroke. And in 1996 we had the FDA approval of a medicine called tissue plasminogen activator, or TPA for short. It's an intravenous medicine that if we give in the first few hours after onset of stroke symptoms can really go into the brain, into the blood vessels in the brain, and help dissolve the clot away. And it's very effective, but it only can be used in the first few hours after onset, and that's really why it's so important to try to educate people and get people to come in sooner and be evaluated. Very common for people to ignore symptoms initially, to wait, to kind of have the attitude that oh, I'll sleep on this, I'll feel better in the morning. The quicker that you can be evaluated for a neurologic symptom that's consistent with stroke, the better your chances of recovery. So part of our system here in Kalispell is trying to figure out a way to help some of the rural communities that don't have access to the specialists that we have here in Kalispell. And one of the ways that we're doing that is through a process called telestroke, or telemedicine. So, for example, a patient would come into the Libby emergency room with an acute stroke. That emergency room doctor would evaluate them very quickly, realize that there was a potential stroke case, and he would call us up on the phone and tell us we have a consultation. We would pull up the internet site at home, and we would be able to see and interact with the patient and the family via the internet in real time, evaluating them and talking to them about their options.